Hello, this is Bree Burns, and my presentation is on vision and hearing in geriatric patients. So, when it comes to changes to vision with aging, things like presbyopia occur, which is when there's a decrease in nearsighted vision, which is why when people get older, they start needing reading glasses or magnifying glasses to read. Their eyelids begin to sag because their skin is losing that elasticity, and that can cause entropion or ectropion, which is pictured here on the right. The top one is entropion, and that's when the eyelid actually turns inward towards the eye, and it can cause irritation. Ectropion is when the eyelid turns outward, and it's that sagging of the eyelid. The eyes can also become drier, and that's due to less efficient goblet cells in the eyes. Um, the cornea of the eye becomes thicker and flatter and less flexible, which causes farsightedness. And that can actually improve sight in people who are nearsighted because it causes them to become more farsighted. The lens of the eye actually becomes thicker and it can become yellow or less flexible, which means that they need more light in order to see and focus on objects, and it can decrease their depth perception or their color perception, so colors are less vibrant. With aging, they can have an increased sensitivity to glare. Changes with hearing in aging include physically, the auricle becomes longer and wider, it's less flexible. This is especially seen in men. The tragus actually enlarges in men. And all these things combined makes it appear that the ear is overall larger. They can also experience atrophy of the cerumen glands. And what this means is that their cerumen, their earwax, is going to be thicker and drier. And that's going to increase their risk for impactions, which is actually a common cause of hear loss. And fortunately it is reversible. So that's a picture here on the right. This is a normal eardrum compared to an eardrum that is impacted with cerumen. The joints within the ear can also stiffen, so those bones that are used to vibrate sounds and translate to the brain sounds, the joints start to stiffen, so that reduces those vibrations. Um, And lastly, the auditory canal itself can begin to narrow. The hairs within grow stiff and coarse, and they can mix with that cerumen and cause a blockage. So when it comes to assessment of these two systems, vision, they typically need to go see an ophthalmologist who specializes in eye exams. They can use an ophthalmoscope to look in the eye, and they also can use a Snellen chart, which is pictured here. It's probably pretty familiar. The nurse can perform PERLA, knowing that their accommodation might be reduced, or other things because their eyes are getting old and experiencing these changes with age. Assessment of hearing can begin with asking the patient about some history, like if they have any prolonged noise exposure, perhaps maybe in their profession, or maybe they're a musician or something of that sort. You also need to ask the patient about past ear injuries and also medications, because some medications can cause that ototoxicity and affect their hearing. When it comes to the physical exam, we can look at their eardrum, as I talked about on the last slide, and look for that pink pearly color. Notice any buildup of cerumen. Um, and lastly, there are screening tools to assess a patient's hearing. We'll want to ask them questions like, are you having difficulty hearing in noisy environments? Are you having difficulty hearing when you're on the phone or just in daily conversation? Some diseases that can affect vision in older adults include cataracts, which is actually when the lens of the eye becomes cloudy and less transparent. Um, it's been described as if you're looking through a pair of glasses that need to be cleaned. So your vision just overall gets blurry and cloudy. Some causes of cataracts include older age, smoking, UV light exposure, or it even can be caused by eye surgery. Cataracts form painlessly over time, and the most common treatment for cataracts is surgery to remove and replace the lens. Another disease that can affect vision in older adults is glaucoma. This is a group of diseases that damage the optic nerve, so it affects their ability to translate the image to their brain. It can also affect their peripheral vision, so it can go unnoticed for years. There's two types of glaucoma. There's open angle glaucoma and angle closure glaucoma. Angle closure glaucoma is actually a medical emergency. It causes increased intraocular pressure, and it is a medical emergency, so the patient would need to seek help, or blindness can occur in a couple days. Another disease that can affect vision is diabetic retinopathy. Obviously, this happens in diabetic patients and more often in type 1 diabetic patients. And this increases vessel permeability and can overall affect their ability to see. And lastly, there is age-related macular degeneration. Some diseases that affect hearing include, there's two types. There's sensorineural hearing loss and there's conductive hearing loss. Sensorineural hearing loss involves damage to the inner ear or the neural pathways to the brain. This includes things like tinnitus, which is common in older adults, presbycusis, or ARHI, which stands for age-related hearing impairment, which is actually very common. Noise-induced hearing loss is the second most common, and that's caused by direct injury to the sensory hair cells of the cochlea. Both of these types of sensorineural hearing loss are actually permanent and irreversible. Conductive hearing loss involves abnormalities of the external or internal ear. So because of that, there's a lot of different causes. It can be caused by otosclerosis, ear infection, perforated eardrum, fluid buildup, tumors, or most commonly, buildup of cerumen. And if there is a buildup of cerumen and which causes an impaction, we can treat that with irrigation, ceruminolytic products that will break down that cerumen, or we can take it out manually. Some things that you're going to want to educate the patient and their family on when it comes to vision and hearing include how to promote healthy eyesight, which includes things like avoid smoking, exercise, eat lots of green leafy vegetables and fish, maintain your blood pressure and your glucose measurements, especially if you're diabetic, to avoid that diabetic retinopathy. This can also include things like wearing sunglasses and hats outdoors to protect your eyes, wearing safety eyewear when appropriate, visiting an eye care professional routinely, especially if you are diabetic. Another thing to educate on is signs and symptoms of angle closure glaucoma because it is a medical emergency. So these signs and symptoms include redness and pain in and around the eye, severe headaches, nausea, vomiting, and blurring of vision. A third thing to educate on is to ensure that they get regular eye exams, especially if they are diabetic, so we can prevent that diabetic retinopathy, because early on in the disease, there's not that many symptoms, so they're going to have to get eye exams in order to identify any problems. Another thing to educate on is how to promote healthy hearing. So that would include things like avoiding exposure to excessively loud environments, avoid smoking again, maintain your blood pressure and your cholesterol. Make sure you're eating healthy and having having your hearing evaluated, especially if you notice any changes. And most of all, something that is very pressed hardly and that you might need to really educate your patient on is to avoid the use of cotton swabs in their ears because it can actually cause an injury. And lastly, you're going to want to educate on if the patient is using a hearing aid, you'll want to help them understand how to use that hearing aid properly, and they're going to want to gradually increase wearing it over time because if it's a lot of times patients stop using them pretty soon after they start because it's kind of a sensory overload. The sounds sound different and they're sounds that they haven't heard in probably years, so they need to gradually get used to what those sounds are like in the hearing aid. You'll also need to educate the patient, of course, to handle it with dry, clean hands and never to let their hearing aid get wet, so don't wear it when you're swimming or when you're bathing. Finally, we are going to have a case study. Um, This case study discusses a 65-year-old male who presents complaining of hearing loss in both ears. This is just some vital signs provided. Overall, they're within normal limits. After interviewing the patient, the nurse has the following information. He struggles to hear higher tones. The onset of this hearing loss was probably about 5 years ago. He says it's hard to follow conversations, especially in crowded places like family gatherings. He can't think of anything that makes it better, and he's not reporting any other symptoms. So the nurse would have to ask about um, any history of trauma, infections, or exposure to loud noises. He denies all of that, as well as those signs and symptoms that might accommodate hearing loss, like headache, nausea, vomiting, dizziness, tinnitus, and pain. Um, he also tells the nurse about his medical history. He is allergic to penicillin, but he takes aspirin daily, which is something that we would want to take note of. Um, and he doesn't have any relevant family history. Some relevant social history, he says he works at a steel plant. And when asked about the noise level there, he says he just works in the office now, but when he was younger, he worked in the factory, which did get loud sometimes. So that's something to take note of, as well as he does have a history of smoking for a very long time. So the question is, what diagnosis does the nurse anticipate? Presbycusis, because it is common in older adults, and he does have things that are characteristic of presbycusis, like gradual hearing loss, inability to hear higher frequencies. He can't understand conversation when there's crowds and lots of background noise. And he also is a chronic smoker. So all of these things add up to a diagnosis of presbycusis, even though the physical examination was normal. And these are my references. Thank you.